And we also have an update to Omicron, that variant and its cases here in Austin. They seem to be leveling off here.
So much so that we're back to being on the verge of going to stage 4. KXAN's Grace Reeder live in our newsroom. She sat in on today's COVID-19 briefing with our local health leaders.
Grace, how soon could we hit that lower stage, and what is the very latest with Omicron?
Well, it's nice to finally be sharing some good COVID-19 news with y'all. Case numbers are going down fast enough that the local health authority predicted we could hit stage 4 in the next 10 days. And no, she said that new subvariant you mentioned, BA2, is not likely to change the trajectory of this prediction.
I think that we will find that we will still have this decline in case numbers because our community is doing what it needs to protect itself.
That subvariant is believed to be very similar to the Omicron variant, but spread a little bit faster.
And Grace, you've talked before about the real test here being how serious Omicron is and what it does to us here in Travis County. And the way we measure this, of course, is how many deaths we see. And it has been a few weeks now, so do you know what the numbers are looking like?
Yeah, we're getting a better picture of that right now. The health authority says the Omicron variant has thankfully proven to be less severe than Delta, which has meant less COVID-19 deaths here locally. Walks reported during the Delta surge, there were 275 COVID-19 deaths reported in Austin, Travis County. So far, during the Omicron surge, there have been 75. Walks expects those numbers will unfortunately continue to go up, but still not hit levels seen during Delta.
And Grace, they also talked today about how people with underlying health conditions are more susceptible to dying, and we got some good news on that data today as well. What did that show?
Yeah, so that data shows that 95% of people who have died from COVID-19 here in Travis County did have an underlying health condition. The most common, you're going to see on your screen here, were hypertension, which is a fancy word for high blood pressure, diabetes, and cardiac or heart disease. Almost half of the COVID-19 deaths here in Travis County were among people who had high blood pressure. Compare that to asthma and people who are immunocompromised. We hear about those two a lot. Both of those were reported at less than 10%. It's worth noting that national studies show people from ethnic and racial minority groups are more likely to suffer from those chronic medical conditions. Nearly half of the COVID-19 deaths reported here locally were people who identified as Hispanic.
Okay, Grace, important for us to know. Thank you so much. And to read more about today's COVID-19 update from Austin Public Health, click on this story at kxan.com.